everyone. Like Nicola introduced me, I am Zainab Akhter. I'm the Research Associate on the Food, Pregnancy and Me study. Today I'm going to be presenting on the prevalence and socio-demographic patterns of food insecurity during pregnancy. And like Nicola said, this is specific to two regions of deprivation in the UK. So we've got Coventry in the West Midlands and Gateshead in the northeast of England. So the quantitative objectives of the Food, Pregnancy and Me study were, the first one is to measure food insecurity in the third trimester of pregnancy, to estimate prevalence and its association with socio-demographic characteristics. And that's what I'm going to be presenting to you today. We've got two more quantitative objectives. So if you keep your eyes peeled for this research in the future, we're going to have a look at the associations between food insecurity and maternal and child health outcomes. Our primary outcomes are antenatal depression and preterm birth, but we'll also be looking at further maternal and child health outcomes. The last one is to look at maternal diet quality data in the third trimester and explore associations between maternal nutrition and food insecurity. So the methods, we sent out questionnaires to women that were in their third trimester of pregnancy at our two sites, so in Gateshead and Coventry, and we needed 605 people, that was our sample size, to complete that. With them being in their third trimester, we had to wait for their babies to be delivered to then link the data to hospital data on their delivery and health outcomes for mother and baby. The questionnaire data itself included collecting data on food insecurity, diet quality, mental health, and household factors. Like I said, the first objective was to estimate the prevalence of food insecurity and identify socio-demographic patterns. So that's what I'm going to present to you today. And then our next steps are to analyse the outcomes related to maternal and infant health and analyse the dietary and nutrition data. So in our population, we had 608 pregnant women that were eligible to be in the analysis, and out of these, 168, so 28%, were food insecure. So in the analysis, we're presenting this as were not food secure in pregnancy. So they had 97 of them, so 16% of the full population had marginal food security. 41% had low food security, 41 had low food security, which was 7%, and 30 women had very low food security, which was 5% of our population. And we've done some preliminary analysis to look at the socio-demographic patterns in these women. So what the women that are experiencing food insecurity in pregnancy, what do they kind of look like? So just from some initial chi-squared tests that we've done, the women are younger, they have younger maternal age, they're from a minority ethnic group, they have higher parity, they're living in an area of higher deprivation, and they have a lower level of education. So we could use these patterns to kind of identify whether or not someone's at risk of being food insecure. We also, like I said, we looked at the household. So food insecurity is higher in women that are looking for work or unable to work, in those that need to care for their family or they have larger families. If they live in social housing or emergency accommodation, this was a risk factor. Single, separated or divorced individuals were also at higher risk, and also low household income. Households that had severe food insecurity spent less money on food as well. So as part of the nutrition section of the questionnaire, we collected data on supplement usage, and we asked whether or not women take a supplement, any supplement, either in the preconception period or in the first, second and third trimester of pregnancy. Overall, the results were quite good in that most women do take a pregnancy supplement at least one time point. But I looked specifically at the first trimester, with this being quite an important time for fetal development, such as having low folic acid intake, increasing your risk of neural tube defects, and it's a very important time of development. So I looked at first trimester, and first trimester supplement use decreases with increasing food security. So like you can see here, Food secure women, so women that had high food security, 90% of them were taking a multivitamin in the first trimester. And then as the food security level gets lower, up to very low food security, only 66% of women are taking a supplement. In the UK, we have the Healthy Start scheme, and you're eligible for this if you're more than 10 weeks pregnant or have a child under 4 and you are receiving income support, job seekers allowance, universal credit, income dependent pension credit. And yeah, there's eligibility criteria. And these women receive vouchers to help them buy food and drink, and they can also receive supplements. So we haven't fully looked into how many people would have definitely been eligible, because the income threshold is not collected in our data. But 128 women in our population were receiving one of these benefits. And then only 33 women. So only 5% of women were actually receiving Healthy Start vouchers. And of these, only half, again, were receiving the Healthy Start vitamins, which is quite a low uptake. And like I said, mental health is going to be one of our primary outcomes out of the health outcomes. We used the questions from the Edinburgh Postnatal Depression Scale in our questionnaire, and we used a score of above 12 to indicate depression. And as you can see, again, the same pattern, the lower the food security is, the higher the depression rate. So women with high food security, so food secure women, only 8% scored A+, and then as we go up the food security, lower food security categories, so marginal food security, 21% had depression, low food security, 49% had depression, and then for the most food insecure group, which was very low food security, 53% of the women had depression. Yeah, so that was the end of the quantitative evidence so far, but like I said, we've got a lot more steps to do, and hopefully we'll be able to present that research soon. I want to hand over to Ella now, who's going to present on the qualitative data.